I'm Bethany Timm, and here is my presentation on adoption trauma. To begin, what is adoption trauma? Adoption trauma begins when the initial separation from the biological parent occurs, whether that be at birth, later in life, when that adoption begins. There are four different forms of adoption trauma for those adoptees specifically, and that is loss of identity, loss of innate trust, an unhealthy stress response system, and a lack of validation. So, just overall, those are the four main categories of what the trauma is. And while there is trauma for adoptees, there's also trauma for mothers, and that's more related to emotions, psychological issues, and just lack of resources for parenting. And there's special education needed for parents who are going into the adoption process, and it's hard to get access and to afford that. So, now, how has adoption evolved since the 20th century? Adoption has way more research on it and is now seen as a societal intervention, but also a developmental risk. So, kind of to go more into that, as a societal intervention is meaning adoption more positively and associated with having a more stable and supportive home after that initial trauma. Whereas the developmental risk factor is if a child had a lot of trauma, is bringing that trauma into the adoption and they're just not developing well physically or emotionally, and they're just carrying those emotional burdens with them. Third, no child is the same. Everyone has immensely different traumatic situations, and while there are similarities, there are no family situations that are exactly the same. Lastly, more research is just needed overall for especially those children adopted later in life. There's a lot that touches base on earlier, and there just needs to be more seen of how it impacts them past just earlier into their adoption. What factors contribute to adoption trauma? Adoption trauma is seen from abuse situations from the past, age, and language and brain development. So, for abusive situations from the past, that is the most significant impact. If a child has had abuse or trauma, neglect, any hardships or issues in their life before getting adopted, they're most likely to carry that with them into the adoption. And for age, if a child was adopted before 5 months, they're less likely to have developmental or traumatic issues. But if they were developed after 5 months, there's more of an association with those issues of deprivation as well. For language and brain development, if a child was adopted after 25 months, they're more likely to have language developmental issues and issues with language learning and deficits. But if they were adopted before 25 months, they're less likely to have those. For brain development, changes may not appear until teenage years, but for those who have had previous abuse, their memory, emotions, and decision making may become impaired from that. So now to get into the actual studies themselves, McSherry and McAnee had a study in 2022 based off of 17 adopted children, 9 to 14 years old. This study gave checklists and questionnaires, and there were two overall main checklists. The first is regarding adversities. So that means physical, sexual, and emotional abuse. And the second checklist was psychological trauma. So that's more touching on sadness, suicidal ideations, not eating, ever feeling depressed, or loss of appetite. So, asking questions surrounding those topics. So, after gaining evidence from those checklists, the results found that trauma stemmed from pre adoption neglect and hardships. And that was just the main category overall that all the children who did have those was the majority, and that's where most of the trauma was seen. So now going back to more adoption trauma, post-adoption stress is the second study I found, and this was in 2020. And there are professionals from the Center of Development for Evaluation Complexity and Implementation in Public Health Improvement and the School of Social Sciences. So 58 British children over the age of 4 who were in the post-adoption phase were the ones who answered these questions, and they were based off of subgroups and common adversities reported by parents as well. So there was more parental involvement in this study than the last. And results found that nearly 1 in 5, 90% of children were in the clinical or borderline ranges for symptoms of PTS arousal, 14% for PTS avoidance, and 8% for PTS intrusion. So a lot of these issues are related to, the intrusion is nightmares, flashbacks, and fear with traumatic events. Um, PTS arousal is more the sleep problems, attention deficit disorders, and avoidance is just emotional numbness in response to traumatic events. And PTS is post traumatic stress. So overall, a lot of stress was found from, again, that pre-adoption period, and that is where the post-adoption stress is coming from. And while both of these studies are a smaller range of children, they are still very impactful and can infer that this is happening for a lot of other children as well. And another big finding from this study is that while adoption can be associated with the symptoms of post-traumatic stress, it does not cause PTSD. So now that I've gone into the research, I can connect it to maternal and newborn nursing. So, as going into the nursing field, I can give my best prenatal care without bias or judgment. I think it's very important that all nurses do this as well, just to make sure that the mother feels safe, respected, and that she has people on her plan of care and that are rooting for her. And while you might not agree with her decision, it is very important not to show judgment or bias because that can stir a lot of challenges for mom. A second important point is to get her access to emotional counseling. Adoption can be very emotionally heavy for mothers, and it's very important that they can feel safe with understanding their feelings, and emotional counseling will help do that. Third is not only proper care for mom, but care for the whole triad, adoptee, birth parent, and adoptive parent, is so important to keep this process safe and healthy, and that everyone is just aware of what is happening and what kind of communications they want, anything along those lines. Another thing is just overall education and training should be addressed because it supports the best form of care for those pregnant patients. And adoption takes a lot of extra education. And lastly, just reviewing legal and ethical requirements is important as well because there are a lot of different rules around adoption, and reaching out to social work can help with the legal and ethical requirements. And I think it is also very important as nurses to show respect, readiness, and optimism for these patients. For adoption planning, using positive adoption language, such as making an adoption plan rather than giving a baby up. And there's many references on how can be easier, answering any questions, and American Adoptions is a great resource that can help moms. And they actually have 24-hour line for any adoption planning help or any questions related to adoption. What are key takeaways from this presentation? Adoption trauma is linked to pre-adoption abuse and neglect. I think it is very important that people are aware of that, and that is one of the main forms of adoption trauma. And while it's not the only form, it is a significant form. 2, more research is needed in adoption-related areas. While there are a lot of studies touching base, they are smaller studies and there should be more on different age ranges and groups and seeing what is actually being experienced and what are the long-term impacts. Third, compassionate and patient-centered care is so important. It's so important that mothers feel supported and that they can make this process be not as heavy as it is, and that they can just have a happy and healthy family and happy kiddos overall. And here are the resources. Thanks so much for watching.